Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Kidney stones is today's topic in Neighborhood Health Watch, a painful but treatable medical condition that tends to show out and disrupt a person's life in hot weather. So today is perfect to get informed about kidney stones. Men and women can get them and the condition is recurring. Urologist Dr. Michael Byrne with Retreat Doctors Hospital is here to talk more about stones. Talk about how they are formed and why does the hot weather play a factor?
Sure. You know, in the hot weather, we're sweating more, we're losing water from our pores, and as a result, we have really concentrated urine, and that urine is perfect for forming stones.
And what causes them, actually?
Yeah, it's both dehydration and often things in our diet that we take in. Oftentimes, we take in too much salt. As well as different foods can cause kidney stones as well, if we eat them in excess.
And what are some of the symptoms? How do you know that you might want to consider seeing a doctor?
Sure. Well, you'll know right away. I mean, it is an intense pain. I think one of my colleagues said, you wish you were dead, but that was a little dramatic, but certainly it's a horrendous pain in your back.
I've heard people say that, though, that it's extremely painful.
It is. My patients would strangle me for even smiling, but it is. They show up and it is so agonizing, the pain that they have. It starts in their back often and radiates down to their groin, sometimes with blood in their urine, sometimes without.
And who's most at risk?
Yeah, I mean, it's tough to tell.
As you said, I guess it's all contingent upon your diet and lifestyle and that type of thing.
Yeah, men get stones more than women, but those numbers are catching up with each other. I mean, it's roughly 1 in 10 people get kidney stones.
Are stones, when you pass them, is it damaging to your body?
No, and in fact, that's the best way to have a stone treated is for you to pass it on your own. It's often associated with most stones do pass on their own, and they don't cause too much damage on the way out.
That's good news, but surgery is also another option.
Yeah, many stones we do unfortunately have to treat with surgery, and we have some wonderful minimally invasive ways to treat the stones to sort of minimize the burden on patients.
And quickly, there's a hotline, a 24-hour kidney stone hotline that people can call. What are the most asked questions? Do people want relief from pain, or are they just trying to get a diagnosis?
All of the above. I mean, usually when they call, they're in agony, or they feel like they've already had a stone and they feel it coming on, and they certainly want to catch it before it turns into a real problem for them.
I couldn't tell if that number was on the screen or not, but do you know the hotline number?
Yeah, it's 804 560 STONE, S-T-O-N, obviously without the E at the end.
All right, excellent. Thank you so much for joining us. We appreciate it.